COVID-19 has indeed impacted the development of avascular necrosis of the femoral head, also known as osteonecrosis. The pandemic appears to have increased the incidence of this condition in several key ways. Corticosteroid use. High doses of corticosteroids have often been used to treat severe COVID. While these drugs can be life-saving, they are a well-known risk factor for the development of avascular necrosis of the femoral head. Studies have shown an association between the use of corticosteroids during treatment and the subsequent development of avascular necrosis of the femoral head, especially in the hip joint. There is emerging evidence that the virus itself may contribute to the development of avascular necrosis of the femoral head, even in the absence of steroid treatment. COVID triggers a systemic inflammatory response, releasing substances called cytokines that can negatively affect bone cells. The virus can damage the lining of blood vessels and disrupt the body's blood clotting system, leading to a hypercoagulable state. This can cause small blood clots to form that block blood supply to the bone, causing necrosis. The ACE2 receptor, which the virus uses to enter cells, is also found in bone tissue and may play a role in bone health. Infection could potentially disrupt these processes. Of note, some studies have suggested a significant increase in the incidence of avascular necrosis of the femoral head after COVID compared to pre-pandemic levels, with a disproportionately greater impact on young men. The time between diagnosis of the virus and the detection of avascular necrosis of the femoral head can vary, but some reports suggest that it may be shorter compared to the development of avascular necrosis of the femoral head from other causes. Thus, although corticosteroids used to treat COVID are an important factor, the virus itself appears to play a role in increasing the risk of developing avascular necrosis of the femoral head. Early diagnosis, often with MRI, is crucial for effective treatment of this condition. Upon receipt of a complaint of pain in the left hip joint, impaired support and gait. Medical history. According to the patient, he has been suffering for 2 years after COVID. He received conservative treatment at his place of residence. Around the first year, his condition worsened, pain increased. Conservative treatment was ineffective, support and gait deteriorated. Hospitalized for planned surgical treatment. Left-sided Cox arthrosis of the 3rd degree. Combined contracture of the left hip joint, pain syndrome, impaired gait and support. The operation was performed. Total cementless endoprosthesis of the left hip joint with the Irene prosthesis. Surgeon Professor Klimovytskyi Volodymyr.